Wishing you all a very, very good morning. For those of you who already listened to my first talk on piles, we are carrying it forwards. So you gathered that piles for the lay population means anything, any problem occurring in the anal canal or around the anal canal. So they could be hemorrhoids, or they could be fistula, or they could be fissure, or they could be, God forbid, even cancer of the rectum or anal canal. So people, even with cancer, they come to us saying that I've got piles. So we need to examine them to tell them that this is what you truly have. Well, so medically, piles means hemorrhoids. Now, what are hemorrhoids? Hemorrhoids are swollen veins in the anal canal. Now, swollen veins are actually called varicose veins. So it's basically varicose veins in the anal canal. When we talk about varicose veins, lay population, we mean varicose veins of the legs. But actually, hemorrhoids are varicose veins of the anal canal. And why do they happen? Constant habit, a prolonged chronic habit of straining during motion, during passing stools, is what leads to swelling of the veins. You see, if I press my arm for a long time, you can see that my veins have gotten swollen, isn't that? So if I constantly every day for half an hour keep it pressed, naturally these veins will become more and more prominent. And when they become prominent enough, and the stool is passing from the anal canal every day, hard stool, sometimes they start to erode and bleed. So how do you know that you got piles? You get a splash of blood in your pot when you pass motion. That splash of blood is truly called hemorrhoids or piles. They can be first degree, second degree, third degree. First degree is small prominence which bleeds. Second degree is those prominent veins when they become like a bunch of grapes and they start coming out and being felt outside the anal canal when you're cleaning yourself up. They are called second degree. And third degree when they're constantly out of the anal opening. Whenever you find that there's some softish mass which is coming out of the anal opening, they are third degree. So how do we treat them, manage them? In first degree, let's say first, how do we avoid them? For general population advice is, please stop the habit, give up the habit of wanting to strain at motion. People don't know what is constipation. Constipation simply means a habit of having to strain during motion. And sitting at the pot for 10 minutes, 15 minutes, 20 minutes, watching some videos on your phone, or olden days people used to read newspapers on the pot. Well, so that leads to constant increased intra-abdominal pressure, and so swollen veins. So please give up this habit. If you truly have a hard motion, that means there is absence of fiber in your diet, so please add some fiber, be it as isabgol, which is very nice habit to have it every day. Isabgol is a tonic for the intestine. It's not a treatment for neither diarrhea nor constipation. It's a tonic. Take it every day. Isabgol, 1 tablespoon, any which way, be it in milk, be it in water, any which way. Well, or maybe there is a lack of lubrication, or maybe because of the lack of peristaltic movements in the intestine. All these things could be responsible. We can always treat your constipation. So constipation requires treatment. If constipation is treated in time, the piles will never occur. Piles will never happen. Well, but when they become second degree, first degree piles can be treated medically. Second degree piles, when they start coming out of the anal canal, getting touched, you can feel them, then we need to remove them. Earlier days we used to call them surgery. I would call it a small procedure. These days we've got gadgets which can just hold them and remove them. It's a daycare procedure. So don't be scared of surgery. It's not surgery. Yes, it is done in the operation theater under anesthesia, but it's hardly a procedure. There's no stitches. There are no knife or scissors used. We have gadgets which hold them and remove them. And so is the treatment of third degree. It's all a daycare procedure. Don't be scared of them. First of all, try and avoid developing piles by giving up this habit of straining. Secondly, if you have them, please do get them checked up by a qualified doctor. Do you really have piles, or do you have fissure, fistula, or anything sinister? And if you have piles, the treatment is very simple, quick, and short. You will not have any problems. I wish you all the best. I hope you benefited from my talk. Thank you for listening to me.